What's worse than missed opportunity? An innovative solution with a clinical promise, but a tech blind spot that are missing the mark too, but a tech blind spot that bottleneck growth and real impact for clinicians and caregivers, for clinicians and patients. This isn't about having another dashboard, a EHR system that makes things better. It's what happens behind the scene when data is locked, late, or lost. Let's talk about how tech equity is no longer an option. If the underserved community cannot use your solution, you're not just missing the revenue, you're missing the vision. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Welcome to another episode. We are filming at VIVE again with some amazing solutions in the innovation space. We know our audience, you guys, are always the leading changes in the healthcare space. So we care about what can we all do together to help us as clinicians, to help our patients and caregivers and the system as a whole. So today we have Beverly Miner here with us from Consensus Solutions.
Thank you.
We always love to see and hear from our speakers in a sense of what is the gap that really got you into the space for you to create and be part of the business and then driving this big mission right now?
Yeah, it's a great question, Sabrina. For me, it becomes passion a little bit. Is we all have stories. We're all patients in this industry. And we know where we see really, really big gaps in care. We know the frustrations of things like our prior authorization process. We have patients that are sitting waiting to get authorized for treatment that is so important, so critical. I have a personal story where a family member died waiting to get the right kind of authorizations. It's such a broken system. And we also have care continuity breakthroughs and breakdowns. You have a patient that is discharged from the hospital. We are discharging people at higher levels of acuity than we ever have before. They're discharged from the hospital. They either go to a skilled nursing facility or they end up at home health. And all of their continuity records don't follow them. And that's where you end up seeing errors in the system, is that when you've got somebody that's going to a skilled nursing facility, but a day later, the medications upon discharge, their diagnoses, the treatments they had in the hospital will follow that patient a day later. So now you've got a system that really is not taking a look at that patient's journey. We have patients that are upset, patient engagement suffers, and it really becomes, a system that we cannot just keep up if we really want the quality of, health outcomes to be where we want them to be.
Yeah, exactly. And from a surgical standpoint, we discharge patient, and I have plenty of time that I was just baffled. If I discharge on a Sunday, then the discharge team should be able to capture it. Would the pharmacy even open for them to get their medicine? Or they can go send to a local pharmacy that's still open, not waiting for them to drive 2 hours away to go home to pick that up, right? And especially some of these patients living in these rural areas, they just don't have that much system. So is that human element that wasn't enough to capture these? Or do we have system, despite Epic is integrated with a lot of things, right? Yeah, we can immediately say e-script. But if the pharmacy is not open, just because you sit over there, it doesn't mean the patient can get it.
Yeah.
And now they are perhaps fluid overloaded. Now they're having more shortness of breath. Perhaps their oxygen wasn't enough.
Right.
They're went to the ER again.
It becomes an exacerbating problem. And I love what you brought up is in certain areas of, this country where we treat our most vulnerable patients, in underserved markets, we don't have the access to the care. We simply think that health equity is just going to remove all those barriers, but health equity has to equal tech equity. We need to make sure that the technology and the access to being able to get information on patients is equitable. And what that really looks like is that patients discharged from a hospital that needs to be sent to a substance abuse clinic. The substance abuse clinic did not get meaningful UCHR money back from the EHRs. So they aren't certified on a certified EHR. They have their intake, they have their encounter, systems that they work with, but they do a lot in faxing. And our flagship product is digital cloud faxing. It's called eFax. And it's kind of the F word in healthcare these days a little bit, is that, oh my gosh, we have too much unstructured data. And we recognize that too. We recognize that unstructured data has to have data entry done to it to be able to be consumed within applications that are creating a longitudinal record. So we introduced another product called Clarity, and that product does data extraction, and it can be consumed in a system where you don't have to have a lot of data entry. So when you talk about, let's make sure that in those underserved areas where patients have to get their medications, they need to get care from the substance abuse clinic, the community clinic, the birthing center, whatever it may be, that they have to have the right kind of data. They have to have it fast. And we can't wait for people to data enter this. So that's what this solution does, is intelligent data extraction and mapping to whatever system is on the receiving end. Because interoperability is a receiving problem. And we need to make sure that that data is visible, consumable, and now you don't have that same disruptions of care. So the example that we used and we talked about, skilled nursing facility. Patient is discharged from the hospital, discharged to a skilled nursing facility. Well, what if all that data is completely structured and it goes through, a system where it hits the point-click care EHR or the skilled nursing facilities EHR? The admissions nurse takes, or admission administrative person takes a look at, and there's all the patient's record and their information. And they didn't have to invest in expensive technology to do it. So that's where you're going to see on the floor here at VIVE is some of these kind of innovations that we're not talking about interoperability anymore. We're not talking about, I've been in the business 20 years. We've been talking about that forever. We're talking about technologies today that can really solve a specific solution. Discharge planning, referral management, prior authorization, document workflow problems. And when you can solve those problems, you don't have burnout. You don't have nurses that are sitting there doing data entry. They didn't enter this business to do that. And then you can create a natural way that interoperability can work, because now all the data will meet, certain standards. You can go from a cloud fax, extract the data, and it can go into a FHIR.
Right. I think that's a lot of conversation I'm having with these point solution companies is that how do you integrate to the existing workflow? How do you make the rest of the team feel like they're not having extra platform to log in, extra things they have to do, even though the solution is needed, right? So for your point, one of the company that we talked to recently has been, they have a great way to make that multi-pharmacy issues reduced by tracking and analyzing the medications, the cost, because non-compliant is actually just that extra copay they didn't want to pay, right?
Yeah.
And they don't even know where to go to actually have a lower cost place to find the same med. So it's very great sound solutions, and they're helping Medicare, Medicaid patients. But then there are 400 different EHRs. How are you connecting to all of them or just few of them?
Right.
To make sure people don't feel like, oh, this is great, but now you're making me to have another password to another login to get to the things.
Yeah,
right?
It's terrible.
So it seems like you guys you can connect with both the system-wide side as well as these point solutions, and you make the communication much better.
At the back end, we don't want to occupy the eyeballs and the glass. Whatever system it is that you usually work in, we want to make it smarter. We want to make it more informative and actionable. So there's a lot of patient data that will sit within those systems, whether it's an admissions into a skilled nursing facility or some sort of home health app that nurses carry when they go visit a patient. We're not the user interface. We are the efficiency of data being able to be served up in the tools that you already use. So we don't think of ourselves as a point solution. We just think of ourselves as having an ability to make those solutions better because the data itself is accurate. We do confidence scores on all of our content that's released. So you can put business rules in that say, that ICD-10 code isn't coming in at 100% confidence score. So we want a human to look at it. And it really does mean you can continue to use the workflow that you are already doing. Let's just make it faster. Let's make it more efficient. Let's cut out people from the problem. And, AI is all over the floor here. We're just trying to do it in a way that's, really logical and not generating more content and data just to generate more content and data.
Correct. There's always the power of, yes, you have the power in data, but what do you do with the data?
Yeah.
Right? If you have too many data, it's almost like you have too many decisions to make for the resource you have.
Right.
How do you make sense of the output of what the data can mean for you? And for you guys, is you're able to bridge that, right? The people who are front end working with patients out there collecting these data remotely, they have a platform. But for the clinicians, the backend, the nurses, everybody else who need to know this data, have that seamless transition. And on the platform now already using, then you improve access and also people more likely to just simply use everything.
Well, and then think about unstructured data that's sitting in a PDF document somewhere, that's sitting in a scan someplace, cannot be put into your population health analytics, right? So now all of a sudden that data is biased. You are trying to analyze data, to look at risk pools, to look at populations, to look at predictive analytics, and you don't have all the right data. You don't have structured data, unstructured data. So now you're just going to analyze unstructured data. Well, if that's all you're analyzing on, you're missing data from the underserved markets. I have a policy role in my company, and I've talked to the CDC about their data modernization. They want fire. They want fire for surveillance and detections and everything else. And I said, well, what are you going to do with the substance abuse clinic or the community clinic that can't actually send you the fire resource messages that you need? And now all of a sudden your data is biased. So we just have to get out of this unstructured world that we live in. Unstructured data, other industries have figured it out, and we're moving progress that way. And we think our solution, since we're the largest in cloud faxing, we know the problems. We think the solution will leapfrog over that. That concerning issue of here comes this pool of data that's so unstructured. What do we do about it?
Exactly. And that, in any time we're growing or expansion, there's always the ups and downs. And we know that as leaders, as entrepreneurs. So we also like to ask a fun question. If we give you a magic wand and it's like the genie in a bottle, grant you 3 wishes, what would you use it for to further amplify what you guys are doing, to whether it's connecting to the right people, the right partnership, the growth, whatever that is? What do you use it for?
Oh my gosh. Really? Okay. So, and that's a surprise question because you didn't give that to me ahead of time. Well, first and foremost, like I had mentioned, I'm passionate about what drives me to make changes in healthcare and healthcare technology. And I think one of our biggest problems is the prior authorization problems. I mean, look, it came to a head when Brian Thompson was murdered, right? It was deny, delay. We all know that the prior authorization problem is plagued with all those issues. Patients don't get the care that they need. They're constantly having to, work with their payers, work with their providers to get the system fixed. And we're starting to fix it. But unfortunately, what that did is it created mainstream headlines that caused America and American patients to sit there and go, this is a broken system. And how can we fix it? And my magic wand would say, we figure out a way to do prior authorizations where there is no delay in care. And that would be one of the first ones. I have a family member that died waiting to get authorizations. And that just doesn't happen. The second thing is we have burnout in this industry at huge levels. I mean, I've got family, friends, and people I know that are physicians and nurses, and COVID burnt everybody out, but they don't want to be in this business anymore because they're not able to practice for the reasons that they signed up to practice. So we have to figure out a way to get rid of the reasons for burnout. And the reasons for burnout happen to be, a lot of it's bureaucratic. A lot of it is that you have to fill out all sorts of quality metric forms and you're not getting the reimbursements that you need. And I think we need to figure out a way to make this much more efficient so that practitioners of healthcare can actually practice what they need to practice. And then we have to get rid of some of the costs. I mean, this is a ridiculous amount of money that we spend in health and human services, trillions of dollars. And we have to figure out a way to lower the cost of care, lower the drug costs, lower the cost of care for our Medicare and our Medicaid patients, and to make it completely equitable and transparent.
Yeah.
So we remove fraud. We really don't have a lot of abuse in that system of how to pay for people that are sick, that are old, and we're all getting older. So Medicare is going to have its tool to try and fix that system. So I'd like to see those are small little goals that I'd like to see happen in healthcare.
When we dream, we dream big.
Yeah, we do. It's the execution that we have to focus on right now to make some of that stuff happen. But
right. And
we'll get there.
And I think that's the innovation part comes to play is people have to have dreamers. And then once the dreamers connect to the right people, yes, then we can find solutions. And when we're so solution focused, then we just needed to have the right resources and money and people in place who are great at making things happen.
Yeah.
And sometimes we get a lot of the front dreamers in there, and then we talk about it and meetings after meeting, but we couldn't quite get to the end plan, right? And so I think a lot of time is we need to be able to so focus and dive into what is that one thing that we can do so well to help fix it, right? And for you guys, it's you niche down to this interoperability. It's been talked about endless, and now it's like let's connect the dots, and then from the connected dots you can help to push the problem with prior auth, right? Getting the information, and then even from a referral standpoint and transitional care perspective, the quicker we can get to the data that can help us to make a decision, then people are not ending up with drugs that they should be taking but they don't have, or the wrong care plan that was outdated, right?
Yeah,
actually,
right.
Day-to-day hospital care is changing all the time. We need to capture where people are. So what would it be most helpful for the community to do for you guys right now?
Is to look at areas that you have problems with unstructured data. You'll find them. They're like cesspools in healthcare. And where that is really preventing the highest level of patient care, where it is causing you to have to invest in people doing a lot of data entry, where there seems to be frustration in your workforce. And you can even do this to speed up your payments on the treatments that you do for patients. But really what we want the system to do is recognize where is this becoming the biggest issue, and then take a look at the largest digital crowd faxing company that is solving this problem, because we know that our customers, our providers, our payers, our vendor partners, we're all trying to figure out how to make this much more efficient. And we've got a proven solution that I think can do it.
Perfect. For anybody who's in the space of feeling you have a lot of data, you don't know what to do with them, or you actually need to have a better way to translate that data into something useful and connecting the dots with your communities, with the rehabilitation, with anybody that, whether it's the outpatient connecting with other subspecialties, or you have a hospital system that need to connect with your outpatient, because some of them use two different EHR, right? You have to log into different things.
EHRs, yeah.
And it doesn't make sense of constantly in different platforms. So to be more effective, efficient, and cut down the burnout and then the mistakes of those systems, definitely go talk to Beverly. And we know we like to have fun here, and both from podcasting side as our game show side, putting the right people on stage to compete in their field, and the right leaders. So whether it's you in policy, myself in scalability, the people who are in investor, we all need to be in the same dialogue to look at these solutions. And that's how ultimate collaboration come from. So for anybody who are in the space to learn, to grow, to be able to think collaboratively, not just, hey, off-track referrals, and then you have to all start from the ground up and figure out what that could be, then we would love to have a conversation with you, invite you guys on our game show, be on the panels of experts if you are industry leader or people you have a solution you need to showcase, then we'd love to put you on the spotlight. And just like at VIVE, we have these amazing conversations with people who are showcasing today. And we can't wait to see how we are reshaping healthcare altogether.
Yeah, it's been a pleasure. And we're here on the floor at VIVE, 1610. We will be at HIMSS. And otherwise, you can reach us at Consensus Cloud Solutions. So we're at consensus.com. Trying to build a consensus, just like you said. I appreciate being here.
Thank you.
Thanks.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.